Now, live with coverage you can count on. This is CBS 42 KI News at 6.
Cancer targeting men most of the time. It is usually prostate cancer. Tonight, surprising news about bladder cancer, most frequently in men. We'll tell you about a new treatment for it. Little known killer of men, what you need to know about bladder cancer and the new treatment that could save lives. The fourth most common cancer in men is bladder cancer. Is expected to kill about 13,000 Americans this year alone. Medical Watch reporter Seema Mather shows us a new surgical approach that's expected to save one Austinite's life. It's the focus of tonight's Medical Watch.
60-year-old Greg Davidson and his wife Pat have been married 31 years, and they're not ready to let each other go.
I'd like to live another 25 years and be around for my grandchildren and my wife.
A few years ago, Greg noticed blood in his urine, a symptom he later learned was a sign of bladder cancer.
That was responsive to chemical treatment, and I was clear.
But a few years later, the cancer came back.
And some of his bladder cancer is in that very thin area.
Dr. Koushik says Greg's cancer has a high chance of spreading to the muscle.
When you have muscle invasive or what we call metastatic disease, which has gotten to the lymph nodes, the survival rates for bladder cancer can drop rapidly.
To prevent that, Dr. Shaw will remove Greg's bladder and prostate, a surgery that will likely leave him impotent and with a makeshift bladder.
If someone asked you if you were to lose your lower leg and it would save your life, what would you do? You'd accommodate for it and you'd live a happy life. So that's the way I look at it.
And you're in a good position.
Dr. Shaw performs the surgery robotically. With a three-dimensional view, he guides the robotic arms. Dr. Shaw says it's a technique that allows for smaller incisions and better precision. Removing the bladder and prostate robotically is a fairly new method. In fact, including this surgery, it's the third time for it to be done in Central Texas. Dr. Shaw says today's surgery will prevent Greg's bladder cancer from ever returning. Just the assurance Greg and his wife hoped for. Seema Mather, CBS 42 Medical Watch.